Hello fellas, and welcome to another TRT Q&A with me, Paulo Brocado, and today's question comes from Charlie, and he says, has anyone had any luck by quoting the European Association of Urology guidelines at the GP? This paper clearly states that the threshold for loss of vigor for men aged 40 to 79 years is 13 nanomole per liter total testosterone. It also says that younger men can suffer symptoms at low normal levels and that the point at which this becomes apparent varies individually. I'm 27 and have a great lifestyle and have been declining since age 22. I've had 2 total testosterone readings of 12.7 nmol per liter in the last 3 years. I've printed out the relevant pages from the European guidelines to show my doctor, who says my levels are normal as they're within the lab's vast reference range. So basically, we've got a viewer who asks if anyone has had luck by quoting the European Association of Urology guidelines to their GP in the hopes of getting testosterone replacement therapy treatment. And experience has taught many of us that this may not be the case and this may not work. But let's discuss this. Let's have a look. For those of you that are looking for these guidelines, I highly recommend that you have a look at them. I've left a link in the description of this video for the guidelines on male hypogonadism, and this again is by the European Association of Urology, because I had to investigate this myself before taking this question because I wasn't sure what he's talking about, but now I've had a good look at them and they're very interesting guidelines. So I highly recommend that you have a look at them if you are interested in testosterone replacement therapy. So I took a little excerpt out of the guidelines, which is the part that Charlie was referring to, and I'm going to read it to you quickly, but I'll put it up on the screen as well. And it says, in men aged 40 to 79 years, the threshold for total testosterone was 8 nanomole per liter for decreased frequency of sexual thoughts, 8.5 nanomole per liter for erectile dysfunction, and 11 nanomole per liter for decreased frequency of morning erections, and 13 nanomole per liter for diminished vigor. So kind of online with what Charlie was saying in his question. He referenced a range of around about 13 and he said his was 12, but we can clearly see here that there's a range that these guidelines work on of between 8 and 13, depending on what the sort of symptoms are. So he wants to take this to his GP in the hopes of showing this as evidence, look what I found online, look at what the guidelines are, my levels are 12, can you treat me? Now, I know this sounds great on paper, but for many of us, especially in the UK, we've got a lot of more experience to let you know that this may not always be the case. I've myself had a reading of 12 before when I was working with the NHS and they refused to give treatment. So, many institutions like the NHS, especially ones that are sort of socialized healthcare, right? They are going to be less inclined to want to help you usually. Sure, you get exceptions, but normally the case is that you have to be towards the lower end of the range, right? Even at 12, they're probably going to hesitate in a lot of cases, but maybe as you head towards more the 8 and the 9 end of the lower range, they'll be more inclined to consider treatment for you. Now, Europe, I'm talking about the NHS in the UK, right, which was known to be strict. In Europe, they may be a little bit more lenient with these guidelines because it's not sort of socialized healthcare, but it's more sort of a lot of the time it's private or assisted healthcare and that type of thing. So you might have better luck in Europe. But if you're in the UK, you're probably going to have a bit of hassle with this. And so my advice is, look, we know that, people can have symptoms even above 12 or 13, higher up the total testosterone range, maybe around about 14, 15, 16, 17 even, you might experience symptoms. And this is why it's always good to discuss it with a doctor. So taking this here to a doctor might help you on rare occasions, but most of the time, if a doctor is inclined to say no, he's kind of made his mind up on the decision, right? He's probably following a strict set of guidelines and he's not going to stray away from those usually. So my advice is, if you go to a doctor and you present this and they're still not willing to consider your case, find another doctor, right? Let's say you do find another doctor, he's also not willing to, listen to your case. Maybe he's bound by the NHS's guidelines also. find another doctor. If you do this a couple of times and it still doesn't work, then maybe the only option left for you to do is consider private treatment, right? And those are a bit hard to find in the UK. I've had trouble with that myself, but it probably is a step for you to go to. Right now, if you don't have luck with private treatment, or you can't find private treatment, you should have luck with your readings. But if you don't, then you might want to consider maybe one of these sort of online private treatments like I've discussed in previous videos. So you can see I've got a playlist, and I'll link it in the description of this video too. I've got a playlist of videos I've done on a series called Balance My Hormones, which is a service I now use, and a lot of other guys that have seen my channel are now using too, thanks to Balance My Hormones. So if you go down the ladder of you can't get it from the NHS, you can't get it, you've gone to one doctor, you've gone to another doctor, you've tried to look for something privately, you haven't been able to find, and you're still stuck, then maybe you should consider a service like Balance My Hormones, or another service that you may find. I only recommend Balance My Hormones because I use them, and it's the only one I've heard of so far. But if there are other ones, please let me know. I'll be happy to review them and do feedback on them as well. So yeah, if you go private, based on your symptoms, you're usually not going to have a problem. But if you do, I've given you advice what to do there. And that's really it. I mean, I've had a look at these guidelines. They're really good. I know they provide good ammunition, but the ranges are quite low. And most of the guys that come to the channel have ranges that kind of just fall out of that. We're not exactly in that range of 8 to 12. We're kind of in 13, 14, 15, 16. I was in 12, you were in 12, but there's many guys that are just outside of it too, and you still can't get treatment. Even within, you can't get treatment. And that's when you have to consider alternative options. So I hope you found it helpful, and if you guys are looking for the guidelines, again, I've put a link to the document in the description. It's very good reading, just so that you're clued up and that you know what we're talking about, and you can arm yourself with information when you talk to your GP. So good luck. If you have any other questions regarding TRT and getting treatment, especially in the UK and Europe, then just send me your questions in the comment section below, and thanks for watching.